Welcome back, everyone. Halloween, as we know, is the spookiest time of the year, but the costumes and the decor are not the only things that can be scary. In fact, too much candy can have terrible consequences for our teeth. One local dentist says that she sees more adults coming to her office after Halloween, and we do have a special guest in studio this morning to chat with us. Dr. Ivis Hernandez joins us in studio to chat about all of this and how candy can truly impact you and your kids' health. Thank you so much for joining us this morning, Doctor.
Thank you for having me.
You know, we've already started having this conversation at our house. I have two little ones at home. Of course, they're excited about candy for Halloween, but as you were saying, you start to see issues. What do you see from your patients after Halloween?
Well, the funny thing is usually I have parents calling for their kids and not their kids, but mostly for themselves because they've actually gotten into the candy trick-or-treat from their kids, and they end up breaking teeth, pulling crowns, pulling fillings. So usually the day after Halloween, I'm getting phone calls.
Pretty busy.
For the adults and not the kiddos.
And when we know a lot of those candies, you know, whether it's the caramel, it can be sticky or tacky, you have those issues. What are some of the worst types of candy for teeth?
Well, you just mentioned them. It's definitely sticky, gooey, gummy, hard candies like the Jolly Ranchers, the Tootsie Roll Pops, which is both chewy and hard, caramels, gummy bears. You know, those tend to just pull out crowns or pull out a filling or crack a tooth. So those are usually the culprits that, you know, I hear people coming. It's always an interesting story that I hear.
After the day after Halloween.
The day after Halloween. I love getting all the adults confessing, pretty much.
Got into their child's candy bag and they've got a problem.
And here they are,
Well, and the reality is we know the kids and adults are going to eat some of these candies. Are there any that are less harmful to our teeth, or is there something that would be a better option that you would recommend for Halloween?
I would say probably chocolate. It dissolves, it doesn't stick on the teeth. Obviously a better bad choice would be dark chocolate. At least that has some benefits, filled with antioxidants, and you know, so you don't feel quite as guilty eating those, but chocolate would probably be one of them. Nuts, of course, of course you have to be a little careful with the nuts because they also are a little hard, but again, nutritionally, they're a probably better choice. And gum that has like xylitol, because that helps reduce the bacteria in your mouth and it stimulates saliva, and so that helps kind of flush out all that sugar out of your mouth that kind of feeds the bacteria that's in there.
Right.
That causes the damage.
And not just after we eat all of this candy, but year round, we really need to be taking care of our gums and our teeth. What would you tell folks with little ones or people at home what they should be doing?
Well, you know, it's always trying to get rid of what is causing the problem. And so with the little ones, you know, it's make sure they brush their teeth, make sure you give them something to flush out their teeth, make sure they come to the dentist, and, you know, particularly if that is part of their diet, which a lot of times it is, and a lot of foods have sugar that we're not even aware of. But it's, you know, brushing, flossing, and flushing out teeth, and that's pretty much it, and coming in for your regular dental cleanings and exams.
So important to start early, a great conversation to have. So thank you so much,
Oh, well,
Doctor.
thank you for having me.